Hello, Bianca.
Hi, Dr. Schuster.
How's it going?
Good, how are you?
Good. Today we're going to complete a medication history on Mr. Thomas. Okay. You're probably familiar with doing medication reconciliations from school, but since this is your first time doing one here, I'd like you to watch me first and see how I interact with the patient, and then I'm going to watch you do a medication history on Mr. Thomas. I'll give you some feedback afterwards and give you an assessment based on this tool. Are you familiar with it?
Yes, I am. I looked at it before the start of rotation.
Okay, great. Are you comfortable working up the patient in our electronic medical record and with what information to gather before talking to him?
Yes, I think so. So I'm going to look at Mr. Thomas's reason for admission, past medical history, social and family history, documented home medications, and their treatment plan while they're here in the hospital.
Great, sounds like a plan. I'll come back here in about 15-20 minutes. We'll discuss the patient briefly, and then we'll go up and talk to him, okay?
Okay, sounds good. Thank
Great.
you.
Hey Bianca, so tell me what you found out about Mr. Thomas.
So Mr. Thomas is a 53-year-old male, admitted last night with a chief complaint of shortness of breath, which has been worsening for the past 2 days. His past medical history includes type 2 diabetes and hypothyroidism. And per the med list in the EMR, which was last updated in June of last year, his medications included Lantus 30 units every morning, Humalog 7 units 3 times a day with each meal, lisinopril 20 milligrams daily, aspirin 81 milligrams daily, and levothyroxine 75 micrograms daily. He's allergic to penicillin with hives as a documented allergy. And currently the primary team is treating the shortness of breath, which is likely secondary to community-acquired pneumonia. He was started on ceftriaxone and doxycycline last night for pneumonia. He was started back on the home insulin regimen, lisinopril and aspirin. Vitals are stable and labs are within normal limits this morning.
Great, good job. Looks like you did a real thorough workup. Knowing what you know now, what types of things are you going to ask Mr. Thomas?
Well, I want to ask about all of the medications he's currently taking, what the doses are, and if he ever misses doses, and since, especially since the med list was last updated about a year ago. So a lot could have changed since then. I really want to make sure we restart the correct insulin dose and lisinopril dose, and just keep an eye on the fasting blood glucose and potassium, since they're a little bit on the higher side this morning. I'm also wondering why the doctor didn't start on levothyroxine yet, so I want to ask if he still is taking that and how much he takes. Oh, and since they started the patient on ceftriaxone and there's a documented allergy to penicillin, I just want to make sure what the reaction was and if he's ever tolerated cephalosporin like Keflex in the past.
Sure, those are great questions to ask. And you also want to ask if there's anything over-the-counter, herbal supplements, things like that that the patient might be taking that aren't on our list, okay?
Right, good point. Hi, Mr. Thomas.
Hello.
My name is Bianca. I'm a pharmacy student, and this is Dr. Schuster. He's a pharmacist as well. I'm here to talk to you about your medications that you take at home. Is it okay if we talk to you for a few minutes?
Sure, that's fine.
Okay, so I have a list of your medications from the computer, but sometimes this becomes out of date after we don't see you for a while, so I just wanted to make sure that we have an accurate list of all your medications. Do you happen to have a list with you or medication bottles with you from home?
No, I don't have my medications with me, and I don't keep a list. I just have them all set up in my kitchen, and I know what to take.
Okay, do you know your medications by memory, or would you like me to go down my list?
I'm not really good at knowing my medication names. You should probably use your list, and I can answer any questions that you have.
Okay, that works fine. So let's start with your medications that you use for high blood sugar. What are you taking for that?
Yes, I do that pen injection at night, and I do another one 3 times a day when I eat. Humalog or something.
Okay, so when you use the Lantus, how many units do you inject?
I use 34 units of Lantus,
Okay, and for the Humalog, how many units do you inject for that when you eat?
and for the Humalog, I do 8, 10, and 8.
8, 10, and 8, okay. Are there times when you ever miss a dose of your insulin?
Once in a while when I go out to eat for lunch or when I'm busy running errands, I forget to take it midday, but that only happens about 3 times a month.
Okay. How often are you checking your blood sugars at home?
Every day, unless I run out of those test strips, because they're really expensive.
Yes, they can be expensive. How often do you find yourself running out and not being able to test your blood sugar?
Well, I've been doing okay lately, but for a few months I ran out for a couple of weeks because of money issues. Then my doctor said to just test once a day in the morning.
Okay. Now, let's talk about your blood pressure. What are you taking for your high blood pressure?
I told you I wasn't good at my medication names. I think it starts with a C. I used to be on that lisinopril, but they switched me to something else because I had this worst cough that wouldn't go away. But the doctor said it was really similar to lisinopril.
Is it called Cozar? The generic name for that is losartan. Does that sound familiar?
Yes, that's it. Losartan. That's the name on the bottle I have at home.
Okay. How long have you been on the losartan and how much do you take a day?
It's been about 2 months now that they switched me over. I think it's 50 milligrams once a day or twice a day. I can't remember. I'm sorry. I'm so tired.
That's okay, Mr. Thomas. Are you taking anything else for blood pressure?
No, but I am taking baby aspirin. I think, is that for my blood pressure?
Aspirin is for your overall heart health, not for blood pressure, but since you mentioned it, what dose of aspirin are you taking?
It's the baby one. I buy it from the drugstore. It's a little pill once a day in the morning.
Now, what are you taking for your hypothyroidism or low thyroid?
Yes, I take that every day before I eat or drink. I forgot the dose I take. Come to think of it, I don't remember the nurse giving me that this morning.
Okay, is that the levothyroxine that you're talking about?
I think so.
Okay. So I'll look into that dose. What other medications are you taking besides for the ones that we just talked about?
Nothing. I don't take anything unless the doctor tells me I have to.
Okay. Any inhalers, eye drops, or creams, or even any vitamins
No,
or supplements
none
that
of that.
you use? No? Okay. Okay, great, Mr. Thomas. So which outpatient pharmacy do you use?
I go to the Walgreens on Jefferson and Mount Elliott.
Okay. Do you use any other pharmacies besides that one?
No, never.
Okay. Mr. Thomas, I'm going to call your Walgreens pharmacy so that I can make sure that I have an accurate list of your medications and all the doses that we talked about. And I'll update the computer to make sure that you go home on all the right medications. And I'll also ask the pharmacist there if you need any refills, and we make sure you'll get those before you get discharged.
Sure, that's fine. I don't think I'm running low on my refills, but you can ask them.
Okay, thanks, Mr. Thomas. I'm going to go call your Walgreens very soon. What questions do you have for me right now?
Do you know when I'm going home?
No, I wish I knew, but we'll have to talk to your doctor about that. Thanks for talking to me, Mr. Thomas. We'll see you later.
Okay, thank you.
Thank you.
So Bianca, how do you think that interaction went?
Well, I think it went well overall. I can't believe I forgot to ask about allergies. And maybe I could have probed a little bit more about the diabetes management at home, but I think that he knew his doses pretty well and seemed to have pretty good compliance.
Good. Yeah, I noticed you forgot about the allergies, but don't worry, you can go back and talk to Mr. Thomas in a little bit, okay?
Okay.
Overall, you did a great job talking to the patient. You had a nice rapport there. You asked about the outpatient pharmacy, which is important, and you probed and asked the questions at the right time.
Okay, thank you.
So, after you go back and talk to Mr. Thomas about the allergies, the next step is to call the pharmacy, get the medication history, and update the whole medication list, okay?
Right, I'll go do that now. Hi, my name is Bianca. I'm from the pharmacy department at the Detroit Medical Center. We have a patient who uses your pharmacy, and I'd like to get a list of the medications they're actively filling. Sure, we can just go down your list. Okay, so that was Lantus, 34 units, every night at bedtime. And they have 1 refill, okay? And last filled in June of this year.
So Bianca, what updates have you made to the med list in the EMR?
So after talking to Mr. Thomas and then calling the outpatient pharmacy and taking a look at what we have documented in the EMR, I did find some discrepancies and updated those to reflect the changes.
Good.
So here I have what I changed. So before the Lantus was documented as at 30 units every morning, but I changed that to 34 units every night at bedtime, according to what I learned from the pharmacy and Mr. Thomas. The Humalog was changed from 7 units 3 times a day with meals to 8, 10, and 8 units 3 times a day with meals. The lisinopril needed to be changed to completed status because the patient's no longer taking that medication. And then I added the losartan 50 milligrams daily. I also changed levothyroxine from 75 to 100 micrograms every morning, according to what the pharmacy instructed me to do. And then I kept the aspirin 81 milligrams on the list since the patient did say he's taking it, even though it's not on the outpatient pharmacy list. Oh, and I also talked to Mr. Thomas again about the allergies. He said he's taken Keflex before, so I feel more comfortable now that I know he's tolerated a cephalosporin in the past.
Great. So now that the med list is up to date and the ad hoc form is done, can you tell me what you're thinking of talking about with the primary team?
Right, so I definitely want to talk to the primary team about changing or adding the levothyroxine onto the inpatient med list at 100 micrograms daily in the morning prior to taking any other medications or food. And I want to make sure they discontinue the lisinopril and add on the losartan 50 milligrams.
For sure.
I also want to let them know about the home Lantus dose and Humalog doses. The blood sugars don't seem horribly high right now, but I just want to make sure the patient gets started on the right medications and goes home on the right doses as well, since there is a chance they could discharge her on the wrong dose if we don't let them know.
Good.
Yeah.
I definitely agree with all those recommendations. They may even want to check the A1C
Right.
since he's not been here for a while, okay? And then maybe even a TSH level.
Okay. That sounds good. I'll make sure to talk to the resident now, and I'll let you know if they're receptive to the changes that we made.
Okay, great. Thanks a lot.
Thank you. Hey, Dr. Schuster. So I talked to the resident. He's agreeable to all of the recommendations I made. However, he does want to hold off on the insulin for right now just because the patient's not eating very well. So that's pretty understandable. And he was just really thankful about me taking the time to do the med history and update the medication list. So he's pretty happy.
Great work. How does it feel?
Feels great.
Awesome. You know what? The insulin part does sound reasonable. Just make sure you check in before discharge so we have a plan for the patient when they leave.
Will do.
Great. So since you made quite a few patient interventions in the hospital, you're going to have to edit that ad hoc form in the chart, okay? Do you remember how to do that?
Yes, I do.
All right. Well, go get 'em, Tiger. Okay, Bianca. I saw your ad hoc form updated. Looks good.
Thanks.
Thanks for a job well done with this patient today. I hope you really learned how much of an impact you as a student can make on patients in the hospital. We do a great job here to make sure the medications are accurate, and we can prevent so many errors by doing this just by talking to the patient. Making sure we prevent these errors when they go home, educating them on side effects and things to watch out for as well. Okay? So take a moment, reflect on what you did today, and know that you did a great job.
Thanks. Yes, I definitely realize the importance of doing a thorough medication reconciliation, and not only that, but documenting them correctly, and then also communicating to the primary team. So thanks for guiding me through my first one. I definitely think I can do the rest on my own now.
Great. So I took some time to fill out this form for the competency.
Okay.
You did a great job, so let's take a closer look.
Sure.
You met all the important criteria here. I checked off yes on them.
Okay.
What you did is you went back and talked to the patient about the allergies because you missed that the first time. So
Mhm.
you went back for clarifications and the allergy information. So overall, great job. Take a look at the feedback. Keep up the good work.
Thank you.
You're welcome.